Hello, friends. Great talking to all the budding Ayurvedic physicians and surgeons. I am Dr. Pramod Sulikeri. I am the marketing head of the cardiac surgery department of the KLER Dr. Prabhakar Korea Hospital. I am also the in charge public relation officer and the transplant coordinator of KLER Dr. Prabhakar Korea Hospital. In fact, I am thankful to the principal of Ayurvedic College and all the faculty of Ayurveda, BMK Ayurveda College, for giving me this opportunity to talk to each one of you about one of the most interesting topic and emerging topic. In fact, it is very interesting to interact with you all and share my experience in medical tourism. We'll go in a brief understand what is medical tourism or a health tourism. In fact, I'll be dealing with the very basics in this my very first session. As I progress later, I'll be able to explain to you how you yourself can start and involve in the activities of the medical tourism. And what is all about this medical tourism? We'll have a brief look into it. From an academic point of view, we are supposed to know the definition. According to Goodrich, he is a medical tourism scientist. Medical tourism is an exercise, it is an attempt to attract tourists deliberately, purposely promoting healthcare services and facilities. We are deliberately, purposely promoting healthcare services and facilities along with regular tourist amenities. As the foreigners land into this country, apart from visiting places of tourism or heritage interest, we can make him to visit our healthcare facilities. This is a new concept, this is an emerging concept which was restricted only to the metros like Chennai, Mumbai and Bangalore. It is percolating to the smaller places. You see how beautiful our tourist places. These are the Badami caves, Agastya Tirtha. According to General Agreement on Trade and Service, healthcare is a service. Medical tourism is the second mode of trade in health services. It is another way of presenting our healthcare facilities and services to the people who are coming from abroad. In this method, the patient, what we call are the clients or the customers, start from their country to obtain healthcare services which are offered at a very high quality and at a least cost. They fly from US, they fly from UK, they fly from Germany, land into our country to take care, to visit tourist interest. Apart from that, it is a combination, it is a mixture, tourism and health, and we offer them very good top-notch medical facilities and services at a minimum cost which is almost 1/10 of the cost that is available abroad. What it is? Perhaps by this time you are aware, maybe have understood, I believe you all must have understood, medical tourism means a foreigner who is not able to afford a treatment or a surgery in US or UK or Germany would like to come to another country like India, which is very homely, very friendly, known for very good people, hospitality, particularly Indians are known for very homely and hospitality friendly. You attract them and offer your best of facilities and services. Medical tourism can be elaborated at the process of combining. Why do people come is, number one is top quality hospitals. Top quality hospital and affordable cost. Experienced and expert doctors try and understand, very skillful, very knowledgeable, very talented. and it is a cost effective private medical facility in collaboration with tourism industry. Here is the top notch super specialty state of the art hospital in this country and a tourism industry. It is a combination of health and tourist. It is two components. One is the hospital, which offers all its facilities and services to the patients, and the tourism industry is the one who come and introduce our facilities and services to the needy. Let me repeat it. Medical tourism can be elaborated as a method of combining cost effective private medical facility. It is not just the cost effective, top quality, at par with the hospitals of the western countries or the developed countries, with the tourism industry for superior surgical and other forms of specialized therapy, friends. Of course, in recent times, medical tourism has appeared to be one of the predominant, most important segment of tourism sector in India. Earlier, people used to come to see Ajanta Ellora, Taj Mahal, Badami Caves, Hampi heritage sites, Beluru Halibut, so on and so forth. It is one way of earning the revenue to the country. Here, look, gentlemen, look, foreigners. Apart from that, our hospitals can also offer you wellness, good care, good treatment. So that is how it happens. Then what is the most important significant factors of the medical tourism? We look into certain unique features. Why do developing countries look at a country like India for a medical tourism? India has got best medical facilities. I keep repeating, one of the cutting edge technologies available in the country, whatever it is available in the so called developing countries. It is not that the machine, men behind the machine, the doctors, the technologists, the paramedics are equally trained, and lower cost of treatment compared to economically developed countries like US, UK, Australia, Germany, France, so on and so forth. We'll continue. Why do Westerners or the developing country, citizens of the developing country, look at our hospitals? A golden opportunity to travel abroad. They get an opportunity from their country to come to our country. Lesser waiting time. In India, if you need a knee replacement surgery, hip replacement surgery, cardiac surgery, cosmetic surgery, dental treatment, panchakarma, wellness, yoga, particularly acupuncture therapy, for all these things, particularly, we can customize and offer, we can re-engineer our services and offer to our guests. They are our guests, in fact. Lesser waiting time. We immediately respond to the people who are our guests without making them to wait and give an appointment, ask them to come on another day. We can immediately take care of the requirement and start the treatment based on their requirement. Further, discharge them and organize their continuity of the trade, and we assure highest degree of patient satisfaction. We take feedback from all those clients who have visited us. What is the scope of India in medical tourism? It is a very important thing. Perhaps you all are looking for this. So we have got a facilities, services, expertise, hospitals, and top-notch technical cutting-edge technologies like robotic surgery, keyhole surgery, minimum invasive surgeries, painless surgeries, post-surgical rehabilitation, immediate and quick recovery, homely feeling to them. Medical tourism is an economic activity. It brings foreign currency to this country. That is the most important component. And they carry back a great memories of this country. We are very hospitable people. Medical tourism is an economic activity that involves trade in services and represents two most significant world industry, medicine and tourism. According to study carried out by Confederation of Indian Industry CII, India is worth $9 billion healthcare tourism industry. I repeat, it could be around close to 700,000 crore rupees business. Why India is emerging as the major power of health tourism? Why it is recognized? Why foreigners appreciate our services? There is a long waiting list in developed countries. If they need a cosmetic surgery, if they need a breast implant, if they need a liposuction, if they need a dental implant, if they need a knee replacement surgery, if they need a cancer surgery, there is a long waiting list. That is how. Less number of beds, less number of doctors, and insurance. There, most of those countries have covered their citizen for insurance approvals. It is a elaborate administrative arrangement. It takes lot of time. And why people look to India is it has got plenty, umpteen number of tourist destination. Every state, from Kashmir to Kanyakumari to Gujarat, Bhuj to Meghalaya or Assam, every state has got a beautiful spot to visit. In India, complicated surgical procedures are performed at 1/10 of the cost that is available in developed countries. And India has got a very affordable international airfares, and within the domestic flights are much more cheaper. Perhaps from Belgaum to Bangalore you can fly in less than 3,000 rupees Indian currency. From Bangalore to Chennai you can fly again in less than 3,000 rupees currency. That is how. And India has got a very good internet connection. Wonderful, great technology is available. New companies like medical tour operator have emerged, and medical tour operators are definitely mediators who promote you. Hospitals are skilled, knowledge based in their own domain of treating the patient, but definitely tourism industry is catered to the tourist. Here the combination and culmination of hospital and tourism industry comes. The staff of the tourism industry, the experts from tourism industry will introduce the needy patients to the hospital. It is the responsibility of the hospital to rise to the occasion of the tour operators so that they satisfy the clients, the patients, international patients, and does obligation to the tour operator also. Why India is a hot destination again? It has got state of the art medical technology, specialist physicians, surgeons, consultants. They are specialized, years of experience, expertise. They are in research mode also. Qualified nurses and paramedical staff. Internationally accepted results. Our own results speaks. English speaking staff. Most of the staff speak English. In other countries, Russia, China, Germany, if you go there, they speak their own language. Very warm and hospitable people. We are very friendly. We are very good. We take care of our guests. Atiti Devo Bhava. We treat them as gods. Again, to make it in very simple, why India? Why do the world look for a health tourism or a medical tourism to India? The number one is very affordable. Waiting list is very bare minimum. We take care of the requirement first. It is not just these two things. People will never come. If cost is less, Waiting list is less, people will not leave. They look for the world class quality. Hospitals are now hospitality industry, excellent doctor, skillful doctor, personalized services. They look for customized service, tailor-made services. We need to take care of the guest, so we do that. Rich cultural heritage. All these things makes it is not just the doctors and the hospitals are good, it will not happen. It has to be cost effective, least waiting time. We need to reach out to them and we need to give them personalized service and good results. And looking at it as a part of medical tourism, India particularly test tube babies, in vitro fertilization, ICSI procedures. For all these things, IVF treatment, India is emerging as the major country. India also offers, particularly who are looking at India, what is the volume of work for which they are coming? It comes top is knee and hip replacement surgery. Definitely they are least waiting time. We have got one of the finest joint and knee replacement surgeon and the cost is 1/10. Bone marrow transplants, cardiac surgeries, coronary artery bypass graft, valvular surgeries. Particularly most of the African countries there is no expertise and hospitals are least. Most of the African countries are looking at India. It is cost effective, very friendly doctors, results are very high, particularly in the case of congenital heart disease like ASDs, VSDs, tetralogy of palate. So many congenital heart defects are there. All these things are being treated very successfully in India with the least cost and very good results. Children can go back to their countries. And and our heart surgeons are saving a lot of precious children, particularly from underdeveloped countries. Cosmetic surgeries, it is one of the most emerging. Yoga, people look at yoga, Ayurveda, Panchakarma, wellness, traditional healthcare system. All these things need to be looked into it. Indian hospitals boast of unique preventive health checkup. Particularly, it is most important that non-communicable diseases are on a big rise, particularly in developed country. Obesity, non-communicable diseases like hypertension, diabetes, ischemic heart disease, stroke, cancer on the rise. Obesity is a major concern. Obesity is adding major burden to the primary health care in developed countries. For that they can come and do a preventive health checkup, and these things are available at a very affordable rate across the country, and it is a 1 day procedure. Your heart, kidney, liver, brain, most of the organs, all the parameters could be checked with a consultation with an expert, and they can have their family members. If a major male patient is undergoing a surgery, the relatives can undergo these preventive health checkup. It is growing, as I told, by 2021 it is almost going to be $9 billion industry, and India ranks second in medical tourism. It is a good news for all of you. You as a budding doctors, rather than treating only us, you need to upgrade your skill. You need to reach out to the requirements. You need to improve the communication, body language. Those are the essential things. And these are the few sites which have brought a traditional tremendous change. And before I conclude, what it is, future of medical tourism is considered as a booster for growing Indian economy. It strengthens Indian economy because they pay in foreign currency. Considering the current trend of world-class facilities, top infrastructure, medical tourism has a huge potential to attract It has got a tremendous power and potential to attract foreigner travelers to India for their healthcare needs. So, our hospitals, our staff, our infrastructure, our roads, our hotel industry, our tourism industry, our own body language, our own smiles need to be very, very good. And with this introduction, I hope I made it amply clear in the very first class. In few of my 2 to 3 interactions with you, I'll be dealing in much more detail in my coming class. Again, I thank the principal of the BM Kankanwadi Ayurvedic College, all the faculties, and you all dear medical students. You've got a great future. Do good job, do ethical practice. We will promote medical tourism together in a big way in this country and assure economic growth of the country, and those who really need the treatment, we can offer them the top quality treatment, elevate their problems. With these few words, thank you so much. All the best. God bless you. Happy Sankranti and Happy New Year. Thank you.